A measles outbreak in South Carolina is now the largest in the United States since the disease was eliminated here more than 20 years ago. The South Carolina Health Department says the number of cases has grown to at least 789. More than 88% of these infections are in children under the age of 18. At least 20 schools have had students in quarantine, and the department says the majority of the affected patients are not vaccinated. For more, let's bring in CBS News Chief Medical Correspondent Dr. Jon LaPook. So, Doctor, what would you say to parents who are hesitant about getting their kids a measles shot?
Yeah, and a lot of times it's like, look, this is my decision. I'm the parent. If I decide I want to roll the dice and not give the measles vaccine to my child, if they end up getting measles, well, that's on me. But you're not just rolling the dice for your own children. You're rolling the dice for millions of infants and babies who are too young to get vaccinated. Remember that the first vaccine is usually at about 12 months, and for about 20 million or more people in America who are immunocompromised, people who are getting chemotherapy, people who have cancer, and they may decide to get the measles shot, but because they're immune compromised, it doesn't take, it's not able to stimulate their immune system enough to give them enough protection. So you're not just rolling the dice for your own child, you're really rolling your dice for the community.
Let's talk about something else to consider, and it's called immune amnesia. What is this?
So this is something that I think a lot of people don't realize. They figure, okay, so my kid gets measles, lots of people get measles, they're going to get a rash, they may get sick, but they're going to recover, they'll probably recover. Well, first of all, you can get really sick from the measles. So about 1 to 3 in 1,000 kids actually die from measles. You can get pneumonia, you can get hospitalized, you can have deafness, right? But let's say you recover from that. It turns out that there's something called immune amnesia. So getting the measles naturally, because a lot of parents say, well, I want them to get it naturally, to get the natural immunity. Well, it ends up dampening the immune system, not just to the measles, but to other things. It dampens your ability, it wipes out your memory for B cells and T cells to be able to deal with things that are like bacteria, other viruses. And so actually, it turns out that in the couple of years after somebody gets measles, the mortality rate goes up from other things, from like pneumonia, say in the first year. This can last for weeks, months, up to a year, and in some cases, it's even longer. But so it's not just that, oh, okay, I'm going to escape and I'm going to have the measles and the kid's going to be fine. You're actually putting your own child at risk for further complications.
A lot to consider. Dr. Jon LaPook, thank you.